As part of that move to improve and advance towards improving the number of healthy people, Dr. Chinyere mentioned preventive care practices offering free blood sugar, free blood pressure, free weight, free height, free physical exams, free body mass index, free counseling for depression and mood disorders, and for sexual abuse, and also recruiting interested healthcare professionals and non-professionals to canvass churches and schools to measure blood pressure, blood sugar, weight, height, and BMI. Experience is not necessary and I'm willing to train. I can be reached at my email drchikito1@gmail.com, my Facebook ID, which is Chinyere Ugorji, my Twitter ID, which is drchikito1, and my LinkedIn ID. Hypertension, hypercholesterolemia, and diabetes are on the rise. About 1 in 3 U.S. adults, an estimated 68 million, have high blood pressure, which increases the risk for heart disease and stroke. Leading causes of death in the United States. That's from the CDC 2012. Do you know what your numbers are? There are only 7 years left to achieve our goals for Healthy People 2020. As part of that move to improve and advance towards improving the number of healthy people, Dr. Chinyere mentioned preventive care practices offering free blood sugar, free blood pressure, free weight, free height, free physical exams, free body mass index, free counseling for depression.
Hi everyone, I'm Dr. Chinyere Ugorji, a 2007 graduate of American International School of Medicine with 10 years of clinical experience working as a certified nurse aide at various facilities, long-term acute care facilities, nursing homes, and also working with patients in their private homes too. And from doing my clinical rotations here in the United States, from 2 graduate medical education programs, Henry Ford Internal Medicine Residence in Detroit, Michigan, from Springfield Family Medicine Residence in Springfield, Illinois, and from doing observerships and externships at various hospitals at various hospitals. And I'm currently involved in education and mentoring of healthcare professionals and counseling of victims of depression and sexual abuse and mood disorders. And I'll be presenting today on depression. I also have some research experience on this topic, working with Dr. Carol North and Dana Downs at UT Southwestern. They are both wonderful people, and my experience in depression improved tremendously during the time I spent doing research there. It's a very important public health topic, and you know that and it's something that I also do. I also do as part of my preventive. I also offer in my preventive healthcare practice, and I'll talk about some of the services that I offer for depression and counseling, which are also on my website. So depression, I'm sorry I don't have my marker today, so I'll probably just talk all this information is on my website, and also can be found on my website. So depression, what do we want to know about depression? I have a case study here which I'm going to share later on at the end of the show, and it's about Josie. She's a 29-year-old lady, and she has a very interesting story. after she came back from her first deployment. So it says, I had once that I'm sorry, I'm putting up the case study right now. Yeah, it says, I had once that Winston Churchill called his depression the black dog. I think it's more like a heavy black cloud that settles all around you. It feels like a lead weight on your shoulders and you can't see through it. All you can see is blackness. I don't know what it was until a few months ago. I recall I was a pretty normal kid. I had ups and downs, but generally I was okay. When I was 23, I was working in a dead-end job, and one day my boyfriend, 2 years, walked out on me. No explanation, just up and left. I was devastated. For the week after that, I barely even got out of bed. I just couldn't find the energy or the motivation to get up or do anything. Luckily, I had some good friends who looked after me and got me back on my feet. I left my job, joined the army, and things really looked up for a while. But after I had got back from the Middle East about 3 months ago, I started feeling horribly depressed. I don't even know why. The deployment wasn't difficult. I wasn't really in danger and I didn't see anything too awful or upsetting. But I just felt worse and worse, and all the things I used to enjoy seemed stupid and pointless. I couldn't be bothered doing anything, not even eating. I didn't have any energy, but I couldn't sleep either. I managed to talk to the doc on the base into giving me a few weeks off sick, but that didn't do any good. I just stayed in bed and cried. Once I even thought about killing myself, but then I thought about what it would do to mom and dad. Then the next section is taking action. And I'll go through that a little bit too. And when I was off sick, I saw an article about depression in a magazine, Beating the Blues. It was called. It was like they were writing about me. They described exactly what I was going through, except for the bit where they talked about treatments and getting over depression, because I hadn't done anything about that. Although part of me didn't believe it, another part of me wanted to give it a try. One thing was for sure, I didn't want to feel like this any longer. So I went back to the doc on the base and asked if I could see the psych. The doctor was pretty crap. I think he thought I just wanted to get out of work. But the psychologist was good. She referred me to a civilian psychologist in town, told me that the ADF would pay all the bills. It was scary going into the psychologist's office the first time. I didn't know what to expect. But the psychologist was really nice. We talked about the problems I'd been having. He said that depression can happen because of all sorts of reasons. Maybe some biological things, maybe some bad habits, maybe some life stress. But he said that there were very effective treatments, and I remember leaving his office that first day with more hope than I had felt for ages. We had about 15 sessions. I hadn't seen him for 6 weeks or so, but I'm going back for a checkup in a fortnight. I reckon I'm traveling well. I also saw a colleague of his, a mental health social worker, I think. She helped me sort out some practical things, like my accommodation and my relationship with my family. Things that were getting in the way of me feeling better. But the most important thing for me was getting back into doing the things I used to love. I realized that if I sat around until I felt motivated, it would never happen. So I forced myself to do things, and the motivation gradually came back. I actually started enjoying myself, and with the psych's help, I started to keep a diary of my thoughts. When I start to think negatively, I write down what I'm thinking, challenge it, and come up with something more helpful. It might sound simple, but it really helps. Now I'm looking forward to the future, and I feel like the cloud has blown away. So that's a very interesting story, and that's something that I just wanted to share as a case study today. She's a 29-year-old girl, a very normal girl who experienced all the symptoms. So, depression is something that you feel. It's a feeling. It's not it's a disease, but it's something that you feel. So, what are the symptoms? Looking at the way that she felt. She felt sad. She felt She felt she felt like not eating. She felt like killing herself at a point. She also didn't have any energy or couldn't sleep. So those were the symptoms she felt. So is this depression? Well, let's find out. Looking at my at at depression. What exactly is depression? Well, first of all, I'll go through the risk factors. What puts you at risk for depression? Well, smoking can put you at risk for depression. Unhealthy relationships, sexual abuse, and violence can put you at risk for depression. Alcohol consumption, physical inactivity, sleep disturbance, and that's from the Center for Disease and Control and Prevention. That's from the Center for Disease Control and Prevention, 2011. The signs of depression: difficulties concentrating, recurrent thoughts of death, depressed or sad mood, diminished interest in activities which used to be pleasurable, weight gain or loss, psychomotor agitation or retardation, fatigue, and inappropriate guilt. So, Jessie actually experienced all those symptoms. She had a depressed or sad mood. She had fatigue. She had diminished interest in activities which used to be pleasurable, and she also had some difficulty concentrating and some recurrent thoughts of death or feeling like killing herself. So she actually meets the criteria for depression. There are 11 symptoms, and to be able to meet the criteria for depression, you have to meet 8 of them. That's according to the guidelines. Now, what are the numbers? If you feel like this, if you have been told that you have depression, is it just you, or are there other people who are also suffering from this disease? Well, it's actually common, and most of them, present to primary care physicians, which is in people like me, people like my colleagues, in residency, my colleagues in their offices, and the incidence is 10 to 14% among patients who present to physician's office for any reasons. These are actually from 2008, from an article in 2008. And so when somebody comes to you with all these symptoms, like Jessie, she had all these symptoms. She had difficulties concentrating. She had feeling sad. She had fatigue. She had feeling like killing herself. You don't just jump into depression. There are some other things that can also cause these problems, some other medical problems, like hypothyroidism, substance abuse. There's some other things that you should think about before you jump into depression, but that should be top on your list as a patient, as a primary care provider. That should be top on your list. So, but there are also many lab tests that you have to do. It's a clinical diagnosis. Once you walk into the clinic, the doctor, most of the time listens to your story, and then after doing the history, and also I'm doing the physical examination, they actually may start you on medication immediately, but some tests are also required before they do that. And at the end, and then after that, what are the treatment options for depression? So that's where I am right now. There are so many medications out there which actually work. That's a good thing, because nobody likes to feel crappy or feel depressed or feel like not doing anything. So there are so many medications out there. There's citalopram, Celexa, there's Lexapro, there's Prozac, there's Paxil, there's Seroquel, there's Risperidone, there's Juodon, there's Zoloft, there's levothyroxine, there's Cytomel, there's lithium, and then there are some medications that have been banned in the United States because of the side effects, and because not enough tests have been done on these medications, or maybe not enough knowledge has been known about this medication. So amitriptyline, is not available in the United States. Lefazodone, trazodone, Remeron, is an option for treatment, and then Wellbutrin is also an option for treatment. And the good news about this medication is that these medications are that they actually work. I've had testimonials from people, and also personal experiences about this medication. They actually work. They have side effects which are numerous, not included in my presentation, which is on my website and also in the videos. But these side effects are actually very minor, and the benefits actually outweigh the risk. My main message today is that yes, there is help for depression. It's a very prevalent disease, and lots of people suffer from it, and it can affect your quality of life. It can actually also affect your family, your relationship at work, your job satisfaction, and but then there is help for depression. And on my website, which is available for patients, I have a form where I actually put some information for depression. It's for counseling, and it kind of goes through the symptoms of depression, kind of like what we just talked about a few minutes ago, and then also about sexual violence, which is something that I also do too. He has a questionnaire for depression and sexual violence, and it goes through all the symptoms. It talks about I have a depressed mood, I have a depressed interest, irregular activities, significant weight change, sleep disturbance, psychomotor agitation. I've been a victim of sexual abuse or violence. I would like counseling for sexual abuse or violence. I would like referral for medical treatment. So all these questionnaires are things that once you answer them, they come straight to my email, and I actually I'm able to look at it, I'm able to contact you, I'm able to talk to you about it, I'm able to make an appointment to maybe see you or provide counseling services, non-licensed counseling services for you with your consent, and then I'm able to refer you to my colleagues too, who can be able to provide licensed treatments, and also the medications, and then also you can also have a part to be part of my research, because I'm also working on a research project named the hereditary nature of depression. I want to know, is it something that is inherited, or is it affected by your environment, or is it hereditary? What causes it? So that would being able to fill out this form, call me, and also get to see me will put you on the list to be part of my research subject, and all the data that will be gotten from the research will go towards research, and will go towards public health organizations. So all this information is on my website, and I'm available and willing to help, you should not be a victim by yourself. You should be able to reach out and get help. It's a public health disease. It's not something that should have a stigma attached to it. You should not feel hesitant about reaching out for help, and I'm part of the move to be able to help victims of depression. And the Powerball question for today, I've put out the Powerball questions, and I haven't gotten anyone to answer them yet. But for depression, it's unhealthy relationships, sexual abuse, and violence is a risk factor for depression, true or false? So we talked about that, and I'll let you go back and look at it. And on Saturday, we are going to do the drawing for all the Powerball questions. I have lots of interesting topics that are coming up on my show, and which have been discussed at various hospitals, various training institutions, and various public health agencies, and all these and all these I'm going to talk about it on my show to be able to educate the general public. And there are also lots of interesting things that are also happening in healthcare at various public health organizations, which I'm going to go over in depth. I actually have a webinar that I'm going to be attending today with Baker Spine. It's at 1:15. They have a lot of offerings, which are actually pretty good educational offerings. And today the webinar is on Provision, and that's utilizing procedure documentation to overcome the challenges of ICD-10 and RAC. So actually recently it was actually on it was actually featured on their Facebook page that the ICD code for the ICD code for some of the surgery procedures that they offer are have actually changed. So they have a lot of updates on in healthcare, what's going on in healthcare, and then from the American Academy of Family Physicians, they have a lot of interesting articles. The July 15th article on edema and cluster headache is actually a pretty good read. I would advise you to check it out. You have to be a member to be able to check it out. And it's a pretty good read, and they have a lot of information on their in social media, on their Facebook page, and Star Wars. That's a move to stop smoking, has actually made lots of great strides recently, and the winner of the 2013 Star Wars, Kinjal Gupta, was actually featured on Facebook. So that's something that healthcare is actually working towards, trying to decrease the incidence of smoking, with education and providing lots of educational materials, campaigns, and trying to decrease all the risk factors that put people at risk for smoking. And the conference is actually coming up soon, and I'm actually going to be part of it, and I'll be bringing you updates too from what's going on. This conference is actually pretty educational, and and they have lots of fun activities, networking activities, lots of educational activities, and also articles that are pretty relevant to current practice. So I'll be bringing you updates from preparations, and also some highlights from previous conferences. I've attended a couple of those before, and they're pretty very interesting. The CME offerings are really very relevant to current practice. From the ACP, the MKSAP question of the week. And they have an MKSAP question that comes up every week, and I would want you to check it out. You don't have to be a member to be able to check it out. It's on subarachnoid hemorrhage. So it's actually on the front page of the website, and um, yeah, so it's 34-year-old woman is evaluated in emergency department for acute onset of a severe headache. She has hypertension treated with lisinopril. On physical exam, blood pressure is 160/100, pulse rate is 78 per minute, and respiration rate is 12 per minute. The physical exam findings are normal. The neuro exam was actually pertinent for somnolence, though she's readily arousable with symmetric and briskly reactive pupils and a left arm drift. The results of the routine lab test are normal. Imaging CT shows a subarachnoid hemorrhage with a thick clot in the right sylvan fissure, but no hydrocephalus or cerebral edema. Angiography shows a 10 mm right middle cerebral artery aneurysm. So the patient undergoes urgent aneurysmal clipping with no complications and is started on nimodipine. She's transferred to the intensive care unit and has no further symptoms until 6 days after initial evaluation, when she's less responsive and has new left arm paralysis and neurologic examination. So what is the next step? So next step is actually CT angiography of the head. So this is clearly subarachnoid hemorrhage. She has all the symptoms, and after going through all, she has all the symptoms, all the lab findings, all the imaging that are relevant to subarachnoid hemorrhage. So at this point, after the clipping, she actually needs to undergo CT angiography of the head. So the explanation is actually on the website, and CT angiography has actually has lots of benefits. It has the additional benefit of imaging the ventricles. It can accurately diagnose cerebral vasospasm requiring medical therapy, and also outcomes are actually poor, because most times there's convulsive and non-convulsive status epilepticus that is associated with poor neurologic outcome. And then lumbar puncture is also an option, and MRI is also an option too. So so CT angiography, that's the next step for these patients, and is actually a very good test for diagnosing cerebral vasospasm, which is a complication that of subarachnoid hemorrhage 5 days after the initial hemorrhage. So the board is actually coming up in October, so I'm gonna be bringing you lots of questions that are also relevant to the boards. The MKSAP offering is actually pretty good for studying for your boards. Then from IHI, they have lots of interesting stuff going on. They have lots of conferences, educational materials, and the upcoming conference on integrating physical and behavioral health, coming up on the 25th of July, seems pretty interesting. I mean, it's something that seems very very relevant to current practice. So I would advise you to check it out and register. And they have lots of stuff going on their website too, and we are all working towards patient safety by increasing education of healthcare professionals, residents and physicians, and they have a lot, the tools to be able to do that. And I feel I'm also part of the move too, to be able to do that too, to increase awareness about current healthcare topics, and also to help to improve research by bringing data to public health organizations. So from STFM, which is the Society of Teachers for Family Medicine, and they also have lots of interesting stuff going on. Conferences coming up, educational conferences coming up. They have lots of educational activities. Their publications are actually pretty good, and to subscribe, what you just have to do is to just email them, and they can be able to send you the subscriptions every day. I actually get some of them, get like lots of educational stuff in my email. It's always advisable to keep reading. And then from the American Medical Association, they have lots of news on things that are going on. Dr. Hovind actually wrote about a CMA series. She was actually on Facebook. I saw her picture on Facebook the other day, and so she also wrote about a series that will help doctors address the national crisis of painkiller misuse. So that's something that has actually been addressed extensively at various organizations, painkiller overdose, and that's something that I'll be talking about too. Coming up soon. Then from the American Psychiatric Association, with DSM-5, that's actually pretty exciting. That gives them a whole new look to psychiatry. Helps us to be able to categorize psychiatric and mental illnesses. So that's pretty exciting in the healthcare field, and they have lots of interesting things on their website too. Publications. You actually have to be a member, but they have a lot of free offerings, and you can be able to sign up for articles. They have offerings ranging from mental health to advocacy, and lots of upcoming conferences too, and lots of multimedia too. So check it out. And then from the CDC, it's 7:32 into my show. Articles, fragile X. That's actually pretty relevant to current practice. Rabies. That's something that we want to know about. Home canning. I actually have some. I have food poisoning as featured in the University of Arkansas. Coming up soon. That's something that is actually relevant in summer. With the heat and the humid temperature. Drought, we want to know about that. Extreme heat, that's a very important topic. So they have all these articles that you can be able to check out, and they also have lots of multimedia, lots of videos, and I would advise you to subscribe to the YouTube channel. That way you can be able to check out what's going on their website, and also in medicine. From the World Health Organization, from the World Health Organization, and they have a lot of highlights on surveys to contribute on the health of adolescents. That's from July 2013, and they also have highlights on pharmaceutical issues for aging conditions. So those are really actually pretty interesting topics. And Dr. Clancy, you're looking at her page. No, Dr. Bagret Shan, I'm sorry. also has lots of archives of speeches and statements. Yeah, so there are lots of interesting things going on in healthcare and with healthcare reform, and I would advise you to check out check out these websites, and also to watch my Ustream show every day, and I'm gonna also work towards getting this into a podcast with updates from medical organizations. That way we can be able to to listen to it wherever you are. Can actually watch it or listen to it, and also in a readable format. We are all working to be able to improve healthcare. So I'm gonna round up right now, and I want to remind you that for your blood pressure, blood sugar, height, weight, physical exam needs, I'm here to help you. Dr. Shikita Mentoring Preventive Healthcare Practice is here to help you and provide you with those needs at no cost, and refer you to licensed healthcare professionals. And also I want to invite you to donate towards my charity work for leukemia and lymphoma. It's called Light the Night Walk. It's a walk for leukemia and lymphoma, and I'll play a little video about it, and I also want to play a video from a very special lady who is part of my team. Her name is Betty. She's I'm part of my team, so I'll just listen to her story. Yeah, I'll just let you listen to her story about why she joined my team. We are gonna be having a lot of interesting things going on on my team. And within the next week, fundraising pages, creating awareness, and recruiting people to be part of the team. And I'd like to listen to her, and then I'll let you listen to what the work is all about. And please feel free to sign up. We want more people on my team. We want to be able to create awareness about leukemia and lymphoma, which I'm going to talk about on my show later on too, and also to be able to raise funds which will go towards research, life-saving research for leukemia and lymphoma. Research is actually a pretty interesting stuff, and there are lots of diseases that can actually benefit from research. Leukemia and lymphoma, sarcoidosis, which my mom suffers from, and other diseases too. And I feel that we can also contribute, even as non-health care professionals, by donating, by creating awareness about these diseases. So I wanted to listen to Betty, and I don't see anybody who has logged in or asked any questions, but
therefore, I have experiences from 4 different countries, and however the Lord wants to use me mightily for His kingdom and His glory, I'm willing. Well, thank you. Thanks a lot, Betty.
That's Betty. She actually has she is actually willing to help, and she'll have her fundraising page on my webpage, which is actually being updated right now. And I'll let you listen to my video about the work, and there are lots of donation tools on my website, And always feel free to call me or to contact me through my email, through social media, and I can be able to accept your donations and sign you up for the work. Depression and the Powerball question for today is unhealthy relationships, sexual abuse, and sexual violence can be a risk factor for depression. I'm expecting to see your answers coming up soon, and the drawing for all the questions, all the topics that have been done will be done on Saturday. And yeah, have a good day, and log in tomorrow for team that rates. Teams of families, friends, co-workers, and local and national corporations come together to raise funds for the Leukemia and Lymphoma Society Fly the Night Walk event and bring help and hope to people back